All right, Deja, thank you. 6:30 this morning. It is tough to think about anything except coronavirus right now. But there's another thing doctors want you to keep your eye on: flu season.
That's right. How do we balance protecting ourselves from the flu and COVID-19? This morning, we're joined, as always, by Dr. Hawkinson from the University of Kansas Health System to talk about that. Dr. Hawkinson, of course, we've been talking to you since this pandemic began now for months. And I can remember even back in March and April, we were talking about how flu season is going to impact this. Do we have any indication yet of how these two are going to meet up once we get into the fall?
Yeah, it's really difficult. You know, with influenza, we always talk about getting ready for influenza season and getting out of it. So we're always in that perpetual cycle. We don't really know. I believe in Australia they've had some improvement in their flu rates. We certainly hope with all these protective measures that we are doing, with masking, with physical distancing, those types of things, the hand hygiene, that influenza will be less prevalent throughout the country this year. But of course, the important thing is to remember to continue to get your influenza vaccine.
Talking about Australia because they have their flu season just ahead of ours, and we've heard a lot about it's a good idea to get your flu shot early as you can this season. Is there truth to that, and how early can we get it?
Yeah, certainly the public health and the CDC stance is to get your influenza vaccine as early as possible, and that's basically so that you don't miss an opportunity to vaccinate. Now that gets less and less because there are so many commercial places that you can get vaccines, not only your doctor's office. So certainly for my patients, for example, patients with HIV who I see in my clinic, I really usually recommend they get their vaccine in late October to early November. This way you have a lot of long-lasting immunity through the end of the flu season. Of course, unless we see a big spike in activity in flu cases, certainly getting it earlier as soon as it's available is the best thing to do. But it just matters, you know, exactly, do you think you're going to have the opportunity later on to get vaccinated? And that's something you can talk with your physician about. But certainly we never want to miss an opportunity for you to be able to get the vaccine.
Last year we talked a lot about issues of teens bringing vaping pens or vaping devices to school with them, using them while they're hanging out with their friends. And we're thinking about the school year starting again. Can COVID-19 or something like the flu spread through vape smoke when it's inhaled? And how does vaping affect your body's ability to fight that?
Yeah, you know, we aren't really too concerned with the exhaled smoke or mist from the vape, but certainly if children, and we heard about this yesterday a little bit, when they are passing around the pens and sharing the pens, obviously it's coming in direct contact with respiratory secretions. Certainly that way is a good mode to transfer it among patients or children. In general, you know, those substances and those chemicals in there are, you know, have been found to be harmful to the lungs. So you add that physical or chemical harm to the lung, and then you also have the virus that is now going to be replicating within the respiratory tract. That certainly can lead to a lot of damage and possibly increase your risk of bad disease, hospitalization, critical illness, and things of that nature.
Dr. Hawkinson, we were talking about back to school there with older kids. I want to go back to younger kids for a second with the flu vaccine. Do we know yet if the mist is going to be available for kids yet this year? I know obviously parents don't want to make their kids get shots if they can help it. Is the mist going to be an option for kids whenever they head back to school? Do we know?
Yeah, I believe the mist is an option this year. I think it was away for 1 or 2 seasons. I believe it was brought back last year. Certainly, if you're a child 2 or above, you can get the mist vaccination if that's available. That's just one other option. You know, otherwise, for the most part, the other vaccines are going to be the injection.
Okay, Dr. Hawkinson, as always, we appreciate your time. Thank you for joining us. We'll see you next week.